Hello students, I will show a surgical procedure, probably rather advanced and very commonly currently used, very common condition. Just identify what is this operative procedure is, and probably newer technique, but commonly done now, useful also for a very common condition. What this operative procedure is, see that somebody is injecting something, markings you can see that here, markings you can see that, and you can see the illumination, very high illumination here. Here also marking on the opposite side. See that what is this operative procedure is. So this is endovenous laser ablation, EVLA for the varicose veins marker, mapping the using the Doppler, and this is the injection of the stimulation anesthesia there. It's a laser fiber tip here. So it is laser is fired for every 3 millimeter for 3 seconds. So EVLA is a very common question asked in the theory. Why in a long case, varicose vein is a long case, so you can be kept when it's kept a long case when during therapeutic discussion. Definitely venous laser ablation they will ask, which is becoming very common, very popular procedure with a good result. So what is diode laser is used? What laser? Diode laser. What is the length, wavelength? 147. Earlier lesser wavelength we have used. Now this is the ideal wavelength. It's done under ultrasound guided. You should have ultrasound guidance on table. Long and short segment veins and communicating veins are treated by this. Heat energy is used to have endothelial thermal damage to lead into ablation. So you ablate the vein, major veins, long saphenous vein, short saphenous vein, and communicating veins. Small venules you may not be able to do that, where you have to do a supportive other foam clearotherapy or other thing, avulsion something. Tumescent anesthesia used while pulling out the laser fiber during ablation. This is the tumescent anesthesia, so it gives a tamponade that it prevents the burn injury to the skin and subcutaneous tissue. It gives the very efficacious laser ablation of the varicose vein. So that is the laser ablation, remember. So different types of treatment, surgical treatment for varicose veins also you have to remember. Trendelenburg operation also called as a crossectomy, and avulsion, foam clearotherapy, then radiofrequency ablation, endotherapy of ligation of the clipping of the perforator therapy, cocket and dot procedure. Different procedures are there for varicose veins. So it's the main question, it's a long case in the exam. So go through the book in detail about the laser treatment, how to examine varicose vein. You can go through my clinical methods in surgery with the video examination of the varicose vein, and detail about surgical principles of varicose vein, pathology, pathogenesis, venous ulcer, complication, DVT, everything. You can read my 7th edition operative surgery in my operative procedure book. In detail it is given. And suturing technique, you can use my atlas, DigiNow, my DigiNow lectures, everything is covered, including varicose vein, small to every topic, operative surgery, urology, specialty, neurosurgery, cardiothoracic, and other things also covered very well. You can subscribe for a year and have a better idea about the entire surgery topic, useful for both UGs and postgraduate, especially when you face the practical exam and theory exam, surgical exam as such. So students, I hope you have understood endovenous laser ablation properly. Thank you very much.